I'm Dr. Gerald Chodak, and this is ProstateVideos.com. Recently, the American Cancer Society issued a new set of guidelines for the screening of men for prostate cancer. Their recommendations are that screening should not take place without first having an informed dialogue between the healthcare provider and the patient, and that information must include the uncertainties, the potential benefits, the potential harms that are associated with screening and subsequent treatment. If a man does decide that he wants to get screened, they recommend starting at age 50, unless there's a family history or if a man is African American, at which point they should start younger, 45 or 40. They also said that if you have a life expectancy that's 10 years or less, that screening should not be done because the harms significantly outweigh any potential benefits. Now, many men may resist that because they feel like they're being discriminated against. But the goal here is to maximize the number of people that are helped and minimize the number of people who are potentially harmed. They also provided information about what to do with your PSA level if you do decide to have it. For those men whose PSA is less than 2.5, the committee recommended that a test should be done only every other year rather than annually. If your PSA is greater than 4, they believe that's a reasonable point to consider a biopsy. But they do acknowledge that there is no PSA level that guarantees the absence of prostate cancer. For those men with a PSA between 2.5 and 4, that should be an individualized decision using a series of risk factors and risk assessments. So that's the basic information that's included. And this is important information that reflects the best scientific information that we have available. The committee acknowledged that there is evidence from one prospective randomized trial that the death rate has been reduced. But there are problems with that study, and most importantly, it required treating a large number of men in order to prevent one death. So the committee is concerned that the potential harms of doing that may offset the potential benefit of preventing that death. As time goes on, we're likely to see changes in that information because those studies only have about 10 years of information. And as the study matures, new information will become available that may allow us to say more about what to expect from screening and treatment. Now, there are important things that are needed. We need a better screening test. PSA is not optimal by any means. It misses many cancers, and it finds too many cancers that are not life-threatening. The committee also acknowledged that we need considerable research into trying to determine which patients really have a life-threatening cancer that needs aggressive therapy. Because increasingly throughout the United States, as I've discussed in previous videos, there are many men who are getting a treatment that is not going to help them live longer or better, and they're being exposed to the potential side effects. So for those of you who are undiagnosed with prostate cancer and want to know what to do, realize that there are several organizations that have been providing information and guidelines to doctors and to patients. We have these American Cancer Society guidelines. We also have guidelines from the American Urological Association and also from an organization called the National Cancer Cooperative Network. All those recommendations are different. As a patient or as an individual who's concerned about prostate cancer, which one of these reflects the best scientific information we have available? And I believe, without question, the American Cancer Society's recommendations are the best information based on good scientific information. So I believe that the American Cancer Society guidelines are the best ones to follow. It doesn't say you shouldn't get treated, but it discourages the national programs that take place during National Prostate Cancer Detection Week, in which free testing is offered, and yet there's no attempt to educate people about those things that the Cancer Society deems to be important. So hopefully those programs will change and not simply have you come in and get your blood test and then later on tell you what the result is, but rather make a good, honest attempt to make sure that you're fully informed and you get to participate in a decision about what to do. Other concerns that have been raised is, will insurance companies look at this information and say, well, we're not going to cover you anymore for your test, and you're going to have to pay for it out of your pocket? Obviously, that would not be a desirable outcome. But I don't think it's likely to happen, because this Cancer Society is not saying don't get screened. Maybe an insurance company will want some evidence that a fully informed discussion did take place, and that would be a good thing to have. But there is reason to be concerned about the time that's going to be required by a family practitioner or an internist or even a urologist to deliver this information to a man who's weighing the decision whether he should get tested with a PSA. That is very time consuming. And although the American Cancer Society is going to provide some aids to help, nevertheless, many doctors are going to be very busy and find it difficult to spend the time that's required. So therein, I think, is the potential problem that individuals may face. Here's the information you need to be receiving. Who's going to have the time to deliver it to you? Perhaps we have to do something else to help that process. But the bottom line here, which is the take-home message, is that screening appears like it can save lives. It does come at a huge trade-off in terms of the side effects it causes and the number of men who get treated without being benefited. But it is the best way to prevent yourself from dying of the disease. And making a fully informed decision, knowing the risks and benefits that are specific for your age and your health, is the best thing you can do. I hope you find this video helpful. Thank you.